The last view we'll obtain in the Pearls exam is the suprapubic view. So when you place your probe just superior to the pubic symphysis and tilt the probe down so it's pointing into the pelvis, you get a view of the bladder here, and behind the bladder you can see this particular ultrasound image was taken of a female, and so the arrows in this image are indicating the vaginal stripe, but you would also see prostate in that location in a male.
To obtain a transverse view of the bladder, position the probe so that the probe marker is pointing toward the patient's right. The urinary bladder is a pelvic organ, so the transducer must be positioned just superior to the pubic symphysis and aimed into the pelvic cavity. In the transverse view, scan the bladder from the proximal to distal end. Obtain a mid-transverse image where the width of the bladder appears to be at a maximum. Adjust the gain and depth to obtain a diagnostic image.
And you can rotate your probe with the probe marker pointing towards the patient's head to get a transverse view of the bladder, and then you can scan across the bladder transversely. You can activate the Doppler to see the ureteral jet, to see urine entering the bladder. And you can look on both the right and the left to make sure that you have urine entering from both sides. If you have the absence of a jet on one side, that can be a sign of a high-grade obstruction on that side.
The suprapubic view is good for looking for free fluid in the pelvis. Sometimes if a patient's sitting up slightly, that is where the free fluid is going to go. For finding unexpected early pregnancies and other pelvic masses, and for evaluating the bladder for distension or masses. But some of the most impressive surprise diagnoses I've made have included something as simple as urinary retention. This slide shows a nice normal bladder on the left with a squared off shape. The middle slide is an elderly patient who's been agitated with poor urine output. The nurse thinks he may need a sedative and a diuretic, but the ultrasound shows he has a huge bladder, like a beach ball, and he needs drainage before we think of any other interventions. On the right is a man I saw in clinic with fatigue and the common old man complaint of urinary frequency. Ultrasound of the bladder showed both his large prostate, which you can just see to the far right of the screen, a bilobed mountain pushing into the bladder, but also an irregular mass, which turned out to be a transitional cell carcinoma of the bladder, which was resected not long after that. And he's alive and doing well without further bladder cancer problems.
This image was acquired from an 80-year-old man with urinary frequency, and here we can see a large round mass at the bottom of the image there, protruding into the bladder. That's his prostate. That's a benign prostatic hyperplasia, and so it was constricting his urethra, and he had a hard time urinating. This is a case where an 80-year-old woman presents with confusion, non-specific flank pain, and it's hard to get a good history from her because of her confusion. But when you point an ultrasound probe down into her pelvis, you see a stone obstructing the ureter, the right distal ureter, and you can see some fluid back up behind the stone. And if you take a look at the right kidney on this lady, you will see some hydronephrosis. So you could have started at the bladder or you could have started at the kidney, but either way you would have gotten some clue that there's an increased pressure in the ureter.